Okay, so about the fracture healing, there are different phases of the fracture healing, but broadly we can classify the fracture healing into the two different types. We can have two major types of the fracture healing. We can have the two major types of fracture healing. The first one can be, it's called the primary healing. It's called the primary healing, and the second one is called the secondary healing. Now, both the conditions, both the process are different basically. In both the conditions, there are different step of the formation. Like whenever we will discuss about the fracture healing, we will discuss about four major stages of the fracture healing. The stage of hematoma, then the fibrocartilaginous callus formation, then bony callus formation, and at last bone remodeling phase. These four phases are important for the fracture healing. But in the case of primary and secondary healing, what's the basic difference? So, all the four phases that I have just named are basically the part of secondary healing. These are not the part of the primary healing. In the primary healing, what happens here? There is no callus formation. When we will discuss about the fracture healing in detail, we will get to know about a section that's a callus formation. एक section समझ में आएगा जिसे हम callus formation कहते हैं. Callus formation is basically a bridging between two fragments of the bone. For example, if this is the bone, for example, if this is the bone here, okay, if this is the bone here, and in this bone, sorry, okay, and in this bone, here we have the fractured fragment. These are the fractured fragments and the fractured area. Now, during the healing process, there will be the formation of bridging of the soft tissues of the fibrocartilaginous structure. Basically, chondrocytes, fibrocytes, and osteocytes and osteoblast cells will come and they will form a bridge here. This bridge will ultimately form a new bone. It will replace with the hard callus formation, hard bony structure, and the bone healing will be completed. But in the case of primary healing, this callus formation won't happen. Okay, in the case of primary healing, this callus formation won't happen. There will be direct healing. There will be bone to bone healing. It's called bone to bone healing. It's called bone to bone healing. And there is no callus formation. There is no callus formation. Okay, here, this was what? This was the callus. But in the case of primary healing, there is no callus formation, there is directly bone to bone healing. It means that in the case of primary healing, the healing will be much faster. Okay, the healing will be much faster as compared to the secondary one. Now, in the case of primary healing, rigid immobilization is a prerequisite factor. Absolute stability, rigid immobilization is much needed for the primary healing. Okay, so we will have a rigid immobilization. Rigid immobilization, or we can say absolute stability. Absolute stability, which is the prerequisite factor, is most needed factor for the primary healing of the bone. Apart from that, it is possible only by surgical fixation of fracture. Without the surgical fixation, with just this close reduction method, we cannot achieve the primary healing. Because in the close reduction, it's quite impossible to go for a rigid immobilization. अगर हम क्लोज रिडक्शन कर रहे हैं, अगर हम नॉन ऑपरेटिव रिडक्शन कर रहे हैं, इन द नॉन ऑपरेटिव रिडक्शन चांसेस आर वेरी लेस दैट रिजिड इमोबिलाइजेशन हो सके. बट इन द केस ऑफ सर्जिकल फिक्सेशन, इफ वी आर यूजिंग द प्लेट्स, इफ वी आर यूजिंग ओरिफ, किसी भी तरह का हम सर्जिकल इम्प्लांट्स यूज करके उसको फिक्स कर रहे हैं, इन दैट पर्टिकुलर केस देयर विल बी रिजिड इमोबिलाइजेशन, और एंड इन दैट पर्टिकुलर कंडीशन द प्राइमरी हीलिंग विल अकर. सो इट इज पॉसिबली ओनली बाय सर्जिकल फिक्सेशन. Possible only by surgical fixation. It is possible only by the surgical fixation. It is very important. Okay, so in the primary healing, the overall factor is that during a surgical fixation, we can immobilize the fragments very rigidly with higher stability. And in that particular case, there is no formation of the callus. There is direct bone to bone healing, and that's why we say that in the surgical conditions, post-fracture in the surgical conditions, the recovery are fast. That's why we as a physiotherapist, when we will go for the rehab protocol, when we will go for the exercise program for any patient, if we have two patients, patient A and patient B, in the patient B, there is closed reduction with POP. And in the patient A, if there is same fracture, but in the case of patient A, there is open reduction. So while progressing with the exercise programs in the patient A, we can progress towards the more complex exercise much faster as compared to the patient B. Because in the patient A, there was rigid immobilization, and because of that, there was rigid stability, absolute stability, and hence the healing will be much faster in the patient A. While in the patient B, since it was a closed reduction, okay, it was not surgical fixation, it was the closed reduction. So in that particular condition, there are chances that there will be very little amount of misalignment can occur. If there is any extra muscle pull, misalignment can obviously occur. In that particular condition, there are need of realigning the bone. If there is any condition that after the close reduction due to any XYZ reason, due to any muscle pull or any patient's action, the bone has become the bony alignment has become misaligned basically. In that particular condition, we will have to go for a realignment of the bone. That's why in the patient B, there is not absolute stability as compared to the in the open as compared to the open reduction. Okay, so that's the primary healing. In the primary healing, there is bone-to-bone healing because of the highly stable fragments of the fracture. While in the secondary healing, what will happen in the secondary healing? In the secondary healing, there is callus formation. There is callus formation. We will have the callus formation, and then we will have bone to bone healing. After the callus formation, bone to bone healing. Okay, initially callus formation is achieved, then the bone healing, then the hard structure of the bone, it will replace the callus of that particular area. Now, in this condition, the immobilization is only in this condition, the immobilization is not that much needed. The immobilization is absolutely needed, but the rigid immobilization is not compulsory here in the case of secondary healing, right? And in the case of secondary healing, one more point is that most fractures treated non-surgically, जो भी मोस्ट ऑफ द फ्रैक्चर्स आर ट्रीटेड नॉन सर्जिकली, उनमें हम क्लोज उनमें हमारा जो सबसे पहला ये चॉइस रहता है दैट्स अ क्लोज रिडक्शन. सो मोस्ट फ्रैक्चर्स ट्रीटेड मोस्ट ऑफ द फ्रैक्चर्स आर ट्रीटेड नॉन सर्जिकली, एंड हेंस दे कैन नॉट बी फिक्स्ड वेरी रिजिडली. उन्हें बहुत ही रिजिड तरीके से इमोबिलाइज नहीं कर सकते हैं. इन दैट पर्टिकुलर कंडीशन सेकेंडरी हीलिंग विल अकर. So the basic difference on the physiological or anatomical point of view here between these two is that in the primary healing there is no callus formation, and in the secondary healing there is callus formation. So we have skipped one stage, one very long stage from the secondary healing to the primary healing. So that's the two major different types of the fracture healing. Now, let's have a look on the different phases of the fracture healing. Like as we have four major phases, four major stages of the fracture healing. Okay, so the next section is the stages of fracture healing. What are the stages? What are the stages of the fracture healing? First stage is the stage of hematoma. A stage of hematoma. The second stage is called the stage of soft callus. A stage of soft callus, or it's also called fibrocartilaginous callus. Third stage is the stage of hard callus. Stage of hard callus. And the fourth one is the last phase. It's called the stage of remodeling. It's called the stage of remodeling. Now, the stage of hematoma will last for less than 5 days, around 1 to 5 days. Then the soft callus phase will go for 5 to 11 days. We can say 5 to 15 actually. Then the hard callus will go from 11 to 28 days. And the stage of remodeling phase from 28 days to it can go up to some years, up to many years. The phase of remodeling can go up to some years also. Okay, so these are the different four phases of the fracture healing, and we have to discuss about all these four phases one by one. Starting from the very first, the phase of hematoma. Hematoma stage. It's the very first stage of the fracture, and this stage begins immediately following the fracture. It means just after the fracture, the stage of hematoma will start. Okay, it starts immediately after the fracture. It means after the fracture, the stage of hematoma will start. What happens in the stage of hematoma, that the blood vessels supplying the bone and the periosteum are basically ruptured, causing a hematoma around the fracture site. It means that, for example, this is a fracture site. Okay, for example, this is the fracture site. Now the blood arteries that were supplying the bone at this particular area, it will rupture and it will form a pool of the blood here. That's basically called as the hematoma. So what happens here, in this phase, the blood vessels supplying the blood, supplying the bone will rupture, and form the hematoma. Okay, so in this phase, the major concern here, the major point here is that the blood vessel has been ruptured because of the fracture, and the pool of the blood, the hematoma, has been formed. Now, if there is hematoma, if the hematoma has formed, if the blood vessel has been ruptured, it will start the inflammatory response. Okay, it will just stimulate the immune cells, it will stimulate the clotting factors, and it will trigger the immune response here. Okay, so at this site, the injury results apart from that, there is one more point. Apart from the immune system stimulation, apart from the immune system triggering, uh, after this phase, actually in this phase, after the fracture and after the rupture of the arteries, the injury results in marginal necrosis of the fracture end. It means that these are the fracture end, there will be some level of necrosis at this particular area. Okay, there will be some level of necrosis at this particular area. It means the edges of the fracture will undergo some level of necrosis uh, after this fracture. Why necrosis is happening here? See, the arteries were supplying the blood to these areas, and if the arteries are ruptured, there is no supply of the blood in this particular area around the edges of the fracture, and hence, because of the loss of the blood here, there will be ischemia, there will be hypoxia, ischemia, and it will undergo necrosis. So after the injury, there will be the marginal necrosis of fracture end and surrounding tissues. Why? Just because of the fracture, just because of the rupture of these blood vessels. So because of the rupture of these blood vessels, what will happen here? There will be necrosis of margin of fracture ends and the surrounding tissues Okay, there will be the fracture, there will be the necrosis of margin of the fracture ends and the surrounding tissues. The major cause behind the necrosis here is the rupture of the blood vessel, that's basically stimulating the necrosis because of the loss of the oxygen, because of the ischemia like condition on that particular area. Now, since there will be necrosis, because of that, there will be inflammatory inflammatory response. How? To initiate any inflammatory reaction, to initiate any inflammatory or immune mediated reaction, there will be some level of inflammatory mediators. So because of the necrosis of the margin of the fracture end and the surrounding tissues, they will release some pro-inflammatory factors, some pro-inflammatory mediators like the cytokines, cytokines will be released. Then there will be the release of interleukin, majorly interleukin 1, interleukin 6, interleukin 23. These all will be released at that site. Apart from that, there will be macrophage. There will be macrophage, and there will be TNF, tumor necrotic factor. It's called the tumor necrotic factor, TNF alpha, basically tumor necrotic factor alpha. So these all are the inflammatory mediators. After the necrosis, these cells will release these inflammatory mediators, and because of these inflammatory mediators, these all will be responsible for the immune response. Okay, these all will be responsible for the immune response. So this all will just start to go for the immune response, and there will be the entry of more immune system cells. Okay, sorry, not macrophage. It's not macrophage. It's called macrophage is obviously the cell of the it's one of the major cell of the immune system. Macrophage not. It's not the inflammatory mediator. मैक्रोफाज इन्फ्लेमेटरी मेडिएटर नहीं, मैंने वहां पे मिस्टेक से वो लिखा था. बेसिकली इट्स कॉल्ड द बोन मैक्रोफाज प्रोटीन्स और समथिंग लाइक दैट. आई एम मिसिंग दैट पर्टिकुलर पॉइंट. Okay, so these all inflammatory mediators, it will just stimulate it will just stimulate the inflammatory response, and the immune cells will reach at the site, and ultimately it will cause the inflammatory reactions. Inflammatory reactions will be visible. Inflammatory reactions will start. Not only the inflammatory reactions, okay, these cells do the job of removing the damaged necrotic cells, since there is the necrosis of the margin of the fractures and the surrounding tissues. So all the cells here will start to go for the macrophage of these different of these cells, like the necrosis of the marginal fracture and the necrosis of the surrounding tissues. Okay, so immune system will come, and it will just remove all the necrotic tissues, and then it will further act. What will be the further action? After that, they will also secrete cytokines, like there is a very important factor that's called the VEGF. It will be released here. What is VEGF? VEGF means vascular endothelial growth factor. Here the VEGF will be released. It won't go for any action. Here only the VEGF will be released, and it will stimulate the healing at that particular site. At this point, the fracture is very unstable. There can be misalignment of the fracture if it is not treated properly. And this VEGF, the role of vascular endothelial growth factor, it is in the next phase, that is the stage of the soft callus. But here in the case of the hematoma stage, what is happening? In the hematoma stage, first point, that it is starting just after the fracture. In this particular stage, the blood vessels supplying the bones will rupture, and it will form the pool. It will form the hematoma, and after that there will be the necrosis of margin of the fracture end and the surrounding tissues. These necrotic cells will start to release some inflammatory mediators like cytokines, interleukins, TNF, tumor necrotic factor, etc. And these all will be released, and these all will just trigger the inflammatory response. And after that, the immune cells will reach at the site, and the inflammatory reactions will start. Not only that, this all will also stimulate the formation of the VEGF, that's the vascular endothelial growth factor. That's the first stage. That's the stage of hematoma. Is it clear? Is it clear? Okay, so after the stage of hematoma, the next stage, the second stage, after the stage of hematoma, the next stage here is the stage of soft callus. The next one here is the stage of soft callus. Now in the soft callus, this is the second stage. In the soft callus, what is happening? See, in the soft callus, the first point here, in the previous section, in the previous phase, there was the release of one very important point that was called the VEGF, vascular endothelial growth factor. So this VEGF, it will stimulate, in this stage, it will stimulate angiogenesis. Angiogenesis, the first stage, the very first event that will happen in the healing process will be the stimulation of the angiogenesis. What is the angiogenesis? What is angiogenesis? Angiogenesis is, it is made up of two words, the angio and the genesis. Angio means the blood artery, basically blood vessel, we can say, blood artery. Genesis means the formation. So the blood arteries that were ruptured in the fractures event, now it will start to regenerate. There will be the regeneration, there will be the formation of the blood arteries. See, for the healing process, we need a proper, we need proper minerals, we need proper nutrients, the oxygen demand will be needed here. And since the blood artery have been ruptured at that particular site, so we will need some blood arteries so that the blood can reach and it can just bring the minerals for the reformation of the bone, minerals for the healing of the bone. If there won't be the formation of new blood arteries, if there won't be the regeneration of the new blood arteries, the new blood vessels, all the compounds, all the minerals won't reach at the site of fracture. And if the minerals won't reach at the site of fracture, there will be no healing. So the very first point here, that the angiogenesis will be stimulated with the help of VEGF. VEGF is basically vascular endothelial growth factor. As the name is indicating, vascular endothelial, it means the endothelial cell that is gonna form vascularity on that particular area. Okay, VEGF, vascular endothelial, it means endothelial cell that will lead to the vascularity. Vascularity, it means the blood flow in that particular area. Now, growth factor, it means the maturation of that particular point. So VEGF will ultimately stimulate the angiogenesis, the regeneration and the formation of the blood artery on that particular area. Okay, apart from that, after the VEGS, if the VEGS have been started, the angiogenesis have been started, the blood artery formation have been started, it means now blood arteries have been started, the blood will start to flow on that particular area. Okay, now, next point here, that here there will be the fibrin-rich granulation cells will develop. Fibrin-rich granulation cells will develop. There will be the development of the fibrin-rich granulation tissue. The granulation cells will start to develop. After that, there will be the presence of mesenchymal cell at that particular point. Mesenchymal stem cells will be present there. Now, the mesenchymal stem cells will start forming three different types of cells. It will start forming three different types of cells. The first, it will start the formation of the fibroblast. Then it will start the formation of the chondroblast. Then it will start the formation of osteoblast. These three cells are very important for the formation of the bone, for the regeneration of the bone. What are the action of these three? Fibroblasts are basically the primary active cells in the connective tissue, and it will secrete the components of the extracellular matrix like the collagen, and it will create it will just create and maintain the structural framework of the body. So the fibroblast will be responsible for the formation of a structural framework with the help of collagen and some other connective tissues. So the fibroblast will be very much important. It will just make the framework with connective tissues and collagen. Okay. So fibroblasts will start to make the framework of the particular bone. Since the bone have been fractured, there will be the needed of the framework. For anything, we need a framework, like to just build a home or to just build a brick. We need a framework for that. Okay. So there will be the need of the framework, and the framework will be formed by the fibroblast cell. Next, The next cell here is the chondroblast. The chondroblasts are responsible for creating and secreting the extracellular matrix that form the cartilage. Okay, chondroblast will help in the formation of the cartilage. It is found in the cartilage tissues. Apart from that, chondroblasts and osteoblasts are involved in different parts of the endochondral ossification process. Endochondral ossification process. There is a new term. Endochondral ossification process is basically the second name of the bone healing. So don't confuse. If it is written if it is written endochondral ossification. Okay, if it is written endochondral ossification. So don't confuse. Endochondral ossification is just the second name of the fracture healing. Okay, so the chondroblast cells. Okay, so what's the major action of the chondroblast? This chondroblast will be responsible for creating the cartilage. Initially, the fibroblast will make the framework with the collagen fiber. Then it will be replaced by the cartilaginous structure, as we have studied that the callus is what? Callus is fibrocartilaginous structure. It means the callus will contain both the fiber as well as the cartilage. The fibers are going to come from the fibroblast cell, the connective tissues, and the cartilage point is going to come from the chondroblast. So the fibroblast blast and the chondroblast, these both will together form, and this both will together form the callus. Okay, so chondroblast will just make the cartilaginous structure, and for your information, these both will make fibrocartilaginous structure. Fibrocartilaginous structure. Now, what's the action of the osteoblast? About this cell, their main role is to produce the building blocks for the new bones. It plays a crucial part in the bone remodeling, the regeneration, and all. One of the major cell of the bone, है ना, ये bone का एक बहुत important cell है. They contribute to the bony formation by laying down extracellular matrix that mineralize to create a bone. It means that osteoblast will start to create extracellular matrix like this. These all will just fuse. These all matrix will mineralize, and it will form a solid bone. So initial action will be only of the fibroblast and the chondroblast cell. The fibroblast will make the collagen, the chondroblast will make the cartilage, and this both will just maintain the framework. After that, the osteoblast cell will come, and it will start to form the extracellular matrix that will mineralize to create a very hard bone. Okay, so that's the three different cells, and these three different cells will start the formation in the soft callus stage. Now, in the case of soft callus, what is happening? In the case of soft callus, because of the formation of the fibroblast and chondroblast, there will be the formation of woven bone-like structure. Woven bone, it means that, for example, these are the fractured fragments. So there will be very small thread-like some structures that will start connecting between these two. Okay, so there will be the formation of woven bone-like structure. Woven bone, it means that there will be thread-like a structure that will start to connect with these two bones. Now, mind it, if that, for example, if the orthopedics or if anyone have immobilized the fracture, and in this and after a few days, after 10 to 11 days, in the x-ray, if we have seen that the bony alignment has been mismatched, or the bone has been misaligned, then till the stage of soft callus we can realign the bone. Till the stage of soft callus, the alignment of bone can be changed, but once it will progress from the soft callus towards the stage of bony callus, there is no possibility of realignment. In that particular condition, one will have to break the healing bone, and he or she will have to go for the retreatment of the reassessment and retreatment of that particular case. So the realignment of the bone is only possible till the stage of the soft callus. Right. After the stage of the soft callus, the third one is the stage of bony callus. Stage of bony callus, the third stage of bony callus. Here in this condition, the fibrocartilaginous callus will start to go endochondral ossification. It means it will start to go the furthermore healing phase. Like in the bony callus, the first point, what will happen here? Till the bony callus, the arterial formation, the angiogenesis has been completed. Okay, about 80 to 90% of the angiogenesis have been completed. It will go until the remodeling phase, but for now, until now, the formation of angiogenesis have been about to complete. It's about 80 to 90% of the angiogenesis have been completed. Now here, the soft callus will undergo endochondral ossification. Ossification, it means what? The chondrocytes will now convert into the no, sorry, not chondrocytes. Here, the osteoblast cells, it will start to generate the matrix, the extracellular matrix to just mineralize the bone. Okay, so this is basically occurred due with the help of osteoblasts. The osteoblasts will just go for this. Okay, here what is happening? The cartilaginous cells will start to calcify. Uh, it means what? It means that the cartilaginous cells will start to ossify. Okay, not ossify, sorry, it will start to calcify. It will start to calcify. The cartilaginous cell will start to calcify. After that, the woven bone type of condition will start to calcify, and the stage of bony callus, it will be visible on the X-ray plates. It's clearly visible on the X-ray. Okay, this can be seen on the X-ray plates. After that, in this condition, in this condition, sorry, in this not in this condition, in this stage, the callus formation in this stage is basically have a special name. It's called the bridging. It's called the bridging callus. The bridging callus, it means what? At the end of this phase, a hard calcified callus of immature bone develops between the fracture ends. That's called the bridging callus. It means the callus that is forming the bridge, forming the bridge between that two particular areas, the two particular fracture ends. That's called the bridging callus. And here, in this condition, in this phase, the newly formed blood vessel will start to proliferate around the further migration of the mesenchymal cell will occur. So basically, what happens here? The first point is that the bridging callus will be formed. It means the soft callus will undergo calcification. The second point is that after the angiogenesis, the newly formed arteries were formed. These newly formed arteries will start to proliferate, and it will furthermore generate, and it will start to supply inside the particular callus. Okay, so in the stage of bony callus, the bridging callus have been formed, and the proliferation of the arterial network have been started. Apart from that, in this condition, we cannot realign the bone. Okay, realignment is not possible here. Realignment is not possible. If still anyone want to realign in this phase, then he or she will have to go for a process that's called osteoclasis. Now, what is osteoclasis? Osteoclasis is just the breaking the bone to just realign it. यानी कि हमने healing bone को break करके उसे वापस से realign किया. Okay, for the realignment in this condition, in the stage of bony callus, we will have to break the healing bone. That's called the osteoclasis, and we will realign the bone for the new immobilization process, for the new treatment process. Okay, the realignment is safe only till the stage of soft callus. In the stage of bony callus, the realignment is not safe at all. Okay. Now, it was the stage of the bony callus. After the stage of the bony callus, the next stage is what? The next stage is the final stage. That's the stage of the remodeling. The stage of remodeling. The stage of remodeling. Okay. Now, in the stage of remodeling, there will be the repeated action of osteoblast and osteoclast cells. There will be the repeated action of the osteoblast and the osteoclast cells, and the repeated action of the osteoblast and osteoclast cells will go for the remodeling. Now, what is the osteoblast? We had already studied that the osteoblast cells are basically responsible for the mineralization, and it will just form the extracellular matters to remove mineralize, and it will form the bony structure. At the same time, this osteoclast cell is have the opposite action, that of the osteoblast. Osteoclast cell will start to degenerate the excess cells, the extra cells or the bony cells. Okay, so there will be the action of both osteoblast and the osteoclast cell for a proper remodeling phase. Now, there are some medical conditions when the osteoclast activity will increase as compared to the osteoblast activities, like the osteoporosis. In the case of osteoporosis, the osteoclastic activity will increase. It means the bone degeneration activity will increase, but the bone regeneration activity will slow down. That will lead to the porous formation as we see in the osteoporosis. But here in the case of the remodeling, there will be a balanced work between the osteoclast and the osteoblast cell. Osteoclast will start to will lead to the degeneration of some cells of the bone, and the osteoblast cells will at the same time it will generate and it will remodel the different types of cells. In the process of remodeling here happens in a block to block. It happens here in the block to block manner. That's called the coupled remodeling. It will lead to the coupled remodeling. Coupled remodeling, why? Because since a couple of cells are responsible here, both osteoblast and osteoclast cells are responsible here. Reabsorption is done by the osteoclast. Osteoclastic cells will go for the reabsorption of the cells, and the formation will be done by the osteoblast cells. Both have the opposite action in nature. Now, in this phase, first of all, the center of callus will be replaced by hard structure. Initially, the center of the callus, it will be replaced by the hard structure, and then further all the structure of the callus, all the fractured area will heal. There is an important law here, that's called the Wolff's law. This Wolff's law says that bone change the shape according to the stress. That's why during the healing process, we generally don't advise the patient to give any extra stress to the healing bone, because as per the stress of the bone, the healing will occur, the shape and the size will be decided. Okay, that's why it is very much needed to keep the bone very stable during the healing process, especially during the remodeling stage. Now, this remodeling phase is very quick in child, but in the adults, it can goes for many years. Okay, so that's the remodeling. After the remodeling phase, the original shape and the size of the bone will be regained. Okay, so that's it about the healing of the bone.